Douglas Holtz-Eakin is my guest with me now. He served under former President George Bush. And sir, good morning to you. Back on health care we are
Good
today.
morning.
Well, what are you saying about the cost? What were your findings?
Well, first of all, I want to make clear the study wasn't done for Republicans. The study was done by the American Action Forum, a nonpartisan think tank. The Republicans are obviously very interested in it because what we've done is dug into the health care reform bill and identified a real weakness in the way it's set up. What you find is that an employer who's, say, paying $12,000 for health insurance could drop that insurance and pay a penalty of $2,000. Now, a lot of people have noticed that, but what's more striking is they could take the $10,000 they have left over, give a little bit of a raise to the worker, send the worker off to the exchanges, and they'll pick up $7,000, $8,000 in federal subsidies, and the worker will be better off, the firm will be better off, and the only person who's going to pick up the tab is the American taxpayer.
So they moved so you concluded that more people move to the government's plan, and the government is obligated to cover them, and that money comes from us. That's your conclusion. Now Democrats would argue, Democrats would argue, look, we can overcome that. We can just cut out the fraud. We can make these cuts in Medicare. That's where the savings will be. So if your conclusion is right, we should be able to make up for it on the back end. You say what?
Two big problems. Number one, it's now widely recognized that this reform does not change the basic trajectory of healthcare costs. They're going to go up, not down. That's a conclusion reached, for example, by the HHS actuary, Richard Foster. That means that all those folks that are in these exchanges, they're going to be more expensive, not less. Second problem is a lot of the cuts that the Democrats are talking about simply aren't feasible. There's nothing about this bill that changes the way Medicare works that would allow it, for example, to operate with $500 billion less in funding. When push comes to shove, the government's going to pay the bill.
I got you. Did you make that conclusion before this was passed into law, or have you changed since then?
This was obvious from the get-go. You could see this in the design beginning back in the House a long time ago. The reliance on pretending that you can build two new entitlement programs, which is what they've done in the bill, and fund them without fixing the existing entitlement programs, that's been a fundamental flaw from the beginning.
Well, it's my understanding, correct me if I'm wrong here, but a lot of this goes to discretionary spending on behalf of Congress, which can go up in any given year or it can go down. I mean, who's to say future Congress doesn't step in and say, you know what, we're going to cut here and trim back a little over here?
Over the first full 10 years of the bill, there will be $2.5 trillion in federal spending. Only $115 billion of that is going to be discretionary spending, the cost of setting up and running the large new bureaucracy. So a very strong-willed Congress could say no to less than 10% of the cost.
Less than 10%. Well, that still leaves us a pretty good chunk on the other end. Well, what happens with the IRS, the new employees there? What happens at Health and Human Services? You have to imagine they'll be hiring as well.
These are all real costs that were left out of the original estimate. I mean, one of the reasons I think people don't understand the cost of this is Congress simply omitted the cost of paying Medicare doctors $350 billion, and they omitted the cost of the IRS agents. There are going to be about 16,000 of those. The hundreds of new employees that are going to be in HHS to run this thing. This is over $100 billion of additional spending.
Douglas Holtz-Eakin, you've done the recent study, and we're going to continue to follow this and dig into it and figure out what the other side's saying along to it. Thank you for your time today, sir. 18 minutes past the hour.